Today we will discuss Biochemistry, Chapter Vitamin. What are vitamins? Vitamins are organic nutrients of low molecular weight that plays a central role in metabolism. Now if we talk about the synthesis of vitamins, they are either not synthesized or are synthesized in inadequate amount by human organisms. Therefore, they must be obtained from an exogenous source such as diet or bacterial flora in the gut. There are two categories of vitamins: fat-soluble vitamins and water-soluble vitamins. If we talk about solubility, the fat-soluble are soluble in fat and water-soluble vitamins are soluble in water. Second, absorption. The absorption of fat-soluble vitamins requires bile salts, while water-soluble vitamins, they undergo simple absorption. Carrier protein is present in here, while there is no carrier protein in case of water-soluble vitamins. Storage. They are stored in liver, while there is no storage of water-soluble vitamins, they are excreted. Excretion. Fat-soluble are not excreted, while water-soluble are excreted in urine. In case of toxicity, so fat-soluble vitamins, they are likely to cause toxicity, while toxicity is highly unlikely in water-soluble vitamins because they are excreted. Treatment of deficiency. In case of fat-soluble vitamins, we can have a single large dose. But in case of water-soluble, we require a regular supply, maybe a dietary supply. The examples of fat-soluble vitamins are vitamin A, vitamin D, vitamin E and vitamin K. While in case of water-soluble, vitamin B and vitamin C. If we talk about the causes of deficiency of vitamins, it could be because of decreased intake, impaired absorption or impaired metabolism or some additional requirement, or there is increased in the losses of the vitamins. Now starting with vitamin A. It is a fat-soluble vitamin. It is a polyisoprenoid compound. It has three forms: retinol, which is an alcoholic form, retinol, which is an aldehyde form, or retinoic acid. Beta-carotene is in plants, is a precursor to vitamin A. One beta-carotene molecule gives rise to two molecules of vitamin A. And this is the interconversion between the three forms of vitamin A. Retinol in presence of reductase can convert into retinol and then into retinoic acid. If we talk about the absorption of vitamin A, intestine is the major site of absorption. If we ingest beta-carotene in the intestine, it will be converted into retinol, then retinol, and retinol will be absorbed along with the bile salts as it is a fat-soluble vitamin. Within the mucosa, retinol is re-esterified with fatty acids and then it is incorporated into chylomicrons. Then it will be transported to the liver. From liver, it will be transported to the peripheral tissues as trans-retinol by retinol binding proteins. If we see the diagrammatic representation, these boxes are the three cells: intestinal mucosa, hepatocyte and extrahepatic cells. Now we can have beta carotene from plant source, or from animal source we can have retinol. These will be absorbed by the intestinal mucosa and they will either transform into retinol and retinoic acid or into retinol esters. And retinol esters can be transmitted by the chylomicrons to the hepatocytes. Then from here, via retinol binding protein, it will be transmitted to the peripheral tissues. If we talk about the biochemical role of vitamin A, which is very important to know, there are four forms of vitamin A. Retinol, its role is it is required as an active form for normal vision. I talked about retinol. If we talk about retinol, it is necessary for reproductive system. If we talk about retinoic acid, it is implicated in growth and differentiation of tissues. If we talk about beta carotene, it acts as an antioxidant. So this is the biochemical role of vitamin A. This is retinol, retinoic acid and beta carotene. If we discuss other biochemical functions, then we can say vitamin A is essential for maintenance of normal epithelium and skin. Retinoic acid has an important role in glycoprotein synthesis. Retinol acts as a steroid hormone. Vitamin A is also required for sulfation of mucopolysaccharides in the matrix of bones. So this is all about the biochemical functions of vitamin A. Now we'll discuss the Wald's WALD''S Wald's visual cycle. We will discuss this in three compartments. One is the photoreceptor matrix, then the retinal pigment epithelium, then the blood and liver. We'll start with rhodopsin. Rhodopsin, in presence of light in the photoreceptor matrix, will release opsin and convert into all trans-retinal. This trans-retinal will migrate to the retinal pigment epithelium. Then it will move to the blood or to the liver, then to the liver. Then trans-retinal via the enzyme alcohol dehydrogenase will convert into trans-retinol, which can via isomerase, retinol isomerase in the liver can convert into cis-retinol, which with the help of the enzyme retinol dehydrogenase will convert into the aldehyde form cis-retinal. Cis-retinal will migrate to the retinal pigment epithelium. In the retinal pigment epithelium, inside the retina, the trans-retinal can directly convert into cis-retinal via retinal isomerase, which is in the retina. And we talked about retinol isomerase in the liver. From cis-retinal, this will migrate to the photoreceptor matrix as 11 cis-retinal. In the dark, it will combine with the opsin to again form rhodopsin. This is the visual cycle, the Wald's visual cycle, wherein we talked about the photoreceptor matrix, the retinal pigment epithelium, the liver or the blood, how rhodopsin converts into the retinal form, the aldehyde form happens in the retinal pigment epithelium, and the alcohol retinol form is in the liver, which can eventually convert into from trans to cis form, and the cis form will convert from alcohol to aldehyde cis retinal, then return back, and then in presence of dark combine again. In the dark they combine again with the opsin to give rise to rhodopsin. So this cycle continues. This is the Wald's visual cycle. And this is very easy to remember, as the aldehyde form is in the retina and alcohol form is in the liver. Rhodopsin in presence of light give rise to transform, and all these transform from aldehyde to alcohol conversion, retinal to retinol requires alcohol dehydrogenase, and also from alcohol to aldehyde the same enzyme dehydrogenase is required, and from trans to cis we required isomerase, and it is a cis form which combines with the opsin to give rise to rhodopsin. In the dark, in the light it gives rise to transform. So we can say that rhodopsin gets depleted in presence of light and gets reformed in the dark. Using this understanding, we can understand one concept known as dark adaptation mechanism. What is the principle behind, I will first of all explain you what is dark adaptation. Bright light depletes stores of the rhodopsin in rods. Therefore, whenever a person shifts suddenly from a bright light to a dimly lit area, he has difficulty in seeing. For example, whenever you enter a cinema hall, initially for a few minutes you found difficult to see, but after a while you are able to see. What happens after a while? After a few minutes, rhodopsin is resynthesized and the vision gets improved. How the principle behind it is that more photons are required to excite already illuminated rods, whereas only a few photons are sufficient to excite rod cells in the dark. This property is called dark adaptation. If you understood that if a rod, when you are outside, the rod cells are already illuminated, so you require more photons to excite that already illuminated rods. While in case of dark, you only require few photons because the rod cells is inactivated. There is enough rhodopsin. You require only few photons to illuminate. While in case of already illuminated, we knew that in presence of light, most of the rhodopsin gets depleted. So we have very few rhodopsin left. So whenever you enter a dark, you require some time to regain your vision, and in that time of the dark, the rhodopsin is resynthesized so that the vision improves. This is dark adaptation. This period is called dark adaptation time, which increases in vitamin A deficiency. Okay. Rods is therefore useful for vision in dim light, while cones are responsible for color vision. Now we can talk about deficiency of vitamin A. So what all will be the deficiency manifestation of vitamin A? Starting with eye, it can lead to night blindness or what is known as nyctalopia, as in the dark adaptation time will be increased. Next, it can lead to xerophthalmia. Xerophthalmia, as the word says, conjunctiva will become dry, thick and wrinkled. Conjunctiva gets keratinized. Next, it can lead to Bitot spots. These are the grayish white triangular plaques which are firmly attached to the conjunctiva. This will lead to increased thickening of the conjunctiva, and Bitot spots are reversible. Next, it can lead to keratomalacia, that is softening of cornea. There will be degeneration of corneal epithelium, which may get vascularized. Later, corneal opacity may develop, and if bacterial infection happens, it can lead to corneal ulcer, perforation of cornea, and total blindness. Next, it can also lead to some skin and mucosal membrane lesions like follicular hyperkeratosis or phrenoderma. It results from hyperkeratinization of the epithelium lining the follicles. So there will be also keratinizing metaplasia of the epithelium of the respiratory tract, GIT, genitourinary tract in case of vitamin A deficiency. There will be reduced mucosal secretions. Epithelium will get atrophied. There will be keratinization of urinary tract epithelium. So it will lead to formation of urinary calculi. There will be alteration in the skin. There will be increased occurrence of generalized infections. If we talk about isotretinoins, which are vitamin A synthetic variants, they are known to decrease sebaceous secretions, hence they are used in treatment of acne. Other manifestations could be a failure of skeletal growth, growth retardation due to defective synthesis of chondroitin sulfate. If we see what are the causes of vitamin A deficiency: obstructive jaundice, cirrhosis of liver, severe malnutrition, or chronic nephrosis. These could be the causes of vitamin A deficiency. Now, how we will assess the deficiency of vitamin A? So you can see the dark adaptation time. It will be increased in vitamin A deficiency. Then you can see the retinol binding proteins. They will decrease in the serum. Then vitamin A levels in the serum, they will be low. then vitamin A may be directly measured by spectrophotometry. Now you can see the dietary sources of vitamin A. There are animal sources and vegetables also. Animal sources, we have milk, butter, cream, cheese, egg yolk, liver, fish liver oil. In vegetables, we have carrot, papaya, mango. If we see the daily requirements of vitamin A, the recommended daily allowances, they are expressed in the forms of retinol equivalents. And one retinol equivalent is equal to 1 microgram of retinol, which is equal to 6 microgram of beta carotene. We see the RDA for infants and children, it is 400 to 600 microgram per day. For men, it is 750 to 1000 microgram per day. For women, it is 750 microgram per day. In pregnancy, it is 1000 microgram per day. In lactation, it is 1200 microgram per day. If we talk about therapeutic uses of vitamin A, one I have already discussed, that is isotretinoin, that is the synthetic form of vitamin A. They are used in treatment of acne because it decreases the sebaceous secretion. The another one is all trans retinoic acid. It is used in the treatment of promyelocytic leukemia. The last topic about vitamin A, the hypervitaminosis A or toxicity of vitamin A. Symptoms are anorexia, irritability, headache, peeling of skin, drowsiness, vomiting. These vomiting and these all symptoms could be because of increased intracranial pressure. There is also enlargement of liver. Skin becomes yellow, but the sclera here is normal. Sclera is normal while the skin is yellow. This is peculiar feature. So this is all about vitamin A. Thank you so much.